Good morning, I'm NG or Ms Ng. I'm from IMC, that is International Medical College, and formerly known as Pantai College of Nursing and Health Science. So Pantai College of Nursing and Health Science was established in 1993 and have a long history of training nurses from all these years. Yeah? In 2012, IMU bought over this college and renamed it to IMC. Yeah? So we are part of IHH, and IHH has 30 over hospitals worldwide, inclusive of Pantai, Glen Eagle, and Parkway. So our students have the opportunity to work in all these areas globally. IMC has two campuses. One is at Subang Jaya and the other one is at Ayer Keroh, Melaka. We offer, the main program is our Diploma in Nursing, which is a 3 years program, and then following that we do have a Diploma, Advanced Diploma in Midwifery, which is a 1 year program, and the others are all 6 months program, like post-basic intensive care nursing, post-basic in pediatric nursing, post-basic in renal nursing, post-basic in peri-op nursing, and we do have post-basic in gerontology nursing as well as emergency nursing in the pipelines at various stages of approval from the Ministry of Education. IMC allows students to have varied experiences. That is, we do send our students to the public hospital as well as to the private hospitals. Here students have all kinds of exposure from both sides, which allow them to have better skill training in procedures. We emphasize a lot on strong foundation in knowledge, besides being skillful and technology savvy. So their employment is actually guaranteed, and they have opportunities to move on globally. As I say, we do have hospitals all over the world, and these girls have the opportunity to progress very well and even experience nursing internationally. Technology is very relevant here, especially in this year and age, and it enables the girls, the students, the nurses to learn and to deal with a lot of gadgets, because in the hospitals there are a lot of technology or gadgets being used on the patient. So you have all kinds of pumps, and if you are talking about ICU, intensive care nursing, they have a lot of latest advances in the respirator or ventilator and various kinds of pumps to assist the nurses and to assist the doctors to make very good decision or good results, and able to give better treatment to the patients. Teaching and learning have already moved on to online. Nursing is supposed to be conventional with a lot of face-to-face and hands-on. But with this COVID experience, we have to change our way of delivery. And we have gone on to do online, that means using e-learning platform for our students to get all their notes and their videos, or any of the lessons that they can learn from the e-learning, and whatever that they need to be discussed, the lecturers are actually using the Microsoft Teams for discussion, and the girls have a lot of interaction through the Teams discussion with their friends as well as with the lecturers. So now that we have gone online, we also need to do procedures using video to let the girls get a feel of how the procedure is going to be, and moving on from that, later on when they able to come on to do hands-on, then they will have minimal time or exposure, face to face. So this is in line with the MCO that is directed by the government. So, but this human interaction will be a bit lacking as you move on, continuing to do online. Nursing is a profession that you need to have contact, human to human contact. And young girls who are new students may not have this kind of experience of contact or seeing a role model that is from the lecturer delivering how they interact with the patient and how they give the human touch, and that could be expressed in like coldness, because the girls may not be able to show their expression, and we may face nursing in a world that is a bit more remote, like taking history also a bit more expressionless, more like a robot taking a history, and interviewing patient, and the expression may be lacking there. So this is one of the things that we hope nursing won't come to, because whatever is it, nurses need to really have contact with the patient and really be able to empathize and able to listen and talk to them, to the patient more. We will have to emphasize a lot of all these soft skills by going through scenarios, going through a lot of all these videos to show how the students can interact with the patient. Though at this time we are not supposed to have face to face, so the girls can be taught that the students can be taught that they have to show and interact with the patient in this way. How to interact, all must be shown, and not be expected that they know. So it has to have, we will have to bring in a lot of scenarios for the girls to get used to it and to learn from all these videos. Nursing is a very good profession, and that's why I'm here for nearly 40 years of nursing experience. But nursing is a very tough profession. You must be able to stand the knocks and the demands of patient, demands also from the doctors and from all health professionals there. It is not for faint-hearted person, because it involves a lot of sacrifice. You must be ready to sacrifice your time, ready to sacrifice your life at home, because your child, you may have a child who needs you, but you cannot be even off to take care of your child, because you got to work to take care of the patients in the hospital. So you need to have a lot of tolerance, patience, and then compassion here, because patients are sick, and their behavior is not something that they exhibit every time, but when they are sick, they will find that they can be very, very demanding, and it is sometimes quite a challenge to really take care of them. And we have to be also resilient, because we have to be able to stand up despite all kinds of adverse reaction or action against us, for us to be able to carry on the day's work and to continue to care for the patient. You must want to care for patient, then only you can make good caring nurse. IMC always will give the best for the students. We will try our very level best to make sure that they go through their training without worrying financially. That means financial worries are none, because we will get them sponsorships or PTPDN and able to, so they are not, they don't have to worry about where they come from. Our students are mostly from the lower income or the middle income, so they need a lot of financial help, and IMC are able to arrange all this for them. So I would think that IMC is a place that most students should come to if they want to carry on nursing without any financial worry. IMC vision is to be a center of academic excellence in healthcare related education. So IMC will endeavor to work towards providing further education for all graduates, because we want to be the powerhouse in nursing education. That means whoever wants to do further education, to progress or to go on in their lifelong learning, they come to IMC. So IMC name will be synonymous to further education or nursing education, especially in all the advanced diploma or post-basic courses.